Economists say the global financial crisis, climate change and instability have worsened the odds that Africa and other developing regions will meet the United Nations Millennium Development Goals by 2015. VOA's Carolyn Turner reports.
Economists at the Carnegie Endowment for International Peace discussed the possibility that Africa could fail to meet the Millennium Development Goals, the MDG, by 2015. But one of the architects of the MDG, formerly with the United Nations, Jan van der Moordely, says Africa is making progress and does not need to meet the global targets.
The majority of African countries are doing good to the extent that Africa is doing much better now since 1990 than in the 70s and the 80s. For instance, girls' education at the primary level is doing wonderful. Africa is doing wonderful in that area. In terms of measles immunization, the highest ever increase that we have seen over the past 10 years in the world has been in Africa. But since they are not achieving those global targets, they don't get the limelight and they don't get into the media.
Salim Jahan of the United Nations says that as elsewhere, development goals for Africa can be accelerated.
I mean, there are certain interventions which have been successfully scaled up in a number of countries in other parts of the world. And what Africa should do is to identify some of those interventions and basically scale them up in their own context. That's number one. Number two, in accelerating the MDG progress in Africa, they will also have to look at some of the structural constraints, whether it is in the form of capacity development, whether it is in the form of institutions and governments, whether it is in the form of policy gaps, and overcome some of those issues there. And finally, I think monitoring and evaluation is important.
But World Bank economist Shanta Devarajan says that pouring money into a system does not generate better services for the poor unless there is some incentive.
In Rwanda, they introduced a scheme where doctors were paid a bonus based on the number of children they immunized or the number of pregnant women that they examined. But it's also led to an improvement in the health indicators in Rwanda. So Rwanda managed to reduce child mortality by about a third between 2005 and 2008.
The World Cup takes place this summer in South Africa, and Jan van der Moordely says that a soccer ball simultaneously represents Millennium Development Goals for Africa.
But we celebrated and we used this soccer ball, combining the World Cup in South Africa with progress being made on those key issues of improving health, improving education, improving nutrition for children. And we take that to primary schools, to secondary schools. We make the children play with it, then they get home, they show this ball to their parents, they say, what is this about? And so we engage the population on the problematic of how do we improve human development.
Economists say the global financial downturn caused 8 to 10 million Africans to fall into poverty, but that some policymakers on the continent lessened its effect by continuing to follow prudent economic policies. Carolyn Turner, VOA News.